Hey Jimmy, have you had anyone come in that has had a jaw issue since I had last came in and you put your fingers in my mouth and it fixed me? Have you had anyone come in or just me?
I think you've been the only one I've seen in like the last like 2 years. I would say that. But it's always a unique like treatment style when I'm like, all right, throw the gloves on, open your mouth, and just go in there, start
Yeah,
on those lateral pterygoids. It's not. It's hard to keep your mouth open when someone's pushing on that muscle in
I
there.
know it. I know
Yeah,
it.
yeah, and it's like dry and it just like you just want to go and like
Yeah.
cough up a little
For,
bit.
for those that don't know, Dr. Jimmy Rowland, awesome guy, PT in the Austin area, great guy. We're going to dive in a little bit more. But like a few months ago, I had like a jaw issue. I couldn't close my mouth. So I was like, Jimmy, what do I do? And he was like, just come in. And I got fixed. But but yeah, I was like, there's no way y'all see people with jaw issues. And he was
Yeah,
like,
not often.
yeah.
But
uh,
it's also one of those things where like someone who has like some neck issue, and then a lot of times you miss clearing the jaw. It's just one of those things you don't innate like go to. But sometimes it's like one of those things where if they have a neck issue, I'll ask them to open and close and go take their jaw like both sides. And then sometimes you catch it, you're like, hey, like you have an issue with your jaw that's probably
dude,
causing some like referral type of pain to your neck. And then they're like, what? I'm like,
yeah, I
oh
think
wow, that blows my mind too.
you and Jordan are both like, dude, your neck's kind of messed up. And I was like, yeah, I figured that I could have used you in college one time. I tell the story. My only touchdown in college was to the other team. I threw a pick six and got just depleted. My helmet popped off and everything. I remember my jaw being all messed up. I could have used you back then too, Jimmy. So, but at least I got you now. So,
Yeah, yeah.
uh,
Here
but
for you, man.
yeah, for everyone tuning in, this is your first time. This is the QB Spotlight the podcast, YouTube episode channel. Wherever you're getting this content, thank you for tuning in. We're a place where we talk all things quarterback, just a big quarterback hub, and we typically have current and former quarterbacks on, coaches on, skill coaches on. Last week we had my mentor Ben Fairchild, a sports performance coach, and this week we got my guy Dr. Jimmy Rowland, who is a physical therapist, performance coach, does a lot of just awesome stuff in the Austin area. Me and Jimmy got connected maybe like 6-ish months ago or so, and he's someone his practice they've seen professional baseball players, football, a lot of different sports, but also just like your general people as well. But for today, we're going to talk about I don't know if a specialty is the right word, but something that he loves to do and he trains a lot of is the quarterback position, right? And so we got some really cool content and info that we want to jump into and talk. And it's going to be similar to what we talked about last week, the performance side of things. It's going to kind of mirror the physical therapy approach as well, and just how important and vital that is to the quarterback position. But Jimmy, real quick, before we kind of dive into the quarterback position, if you don't mind maybe telling everyone maybe 2-3 minutes, just like some quick background about you, because you went to Miami and Dallas, you trained at some really great places. Now you started your own shop here in Austin, trained a lot of great athletes. So maybe just give like a 2-3 minute rundown of like your background, the athletes that you've worked with, and kind of what led you to start working more with quarterbacks.
Yeah, yeah. So originally, I'm from the Ohio area. I graduated with my DPT degree from the University of Dayton. Shortly after doing that, I ended up just getting linked into the sports medicine realm. Got a pretty unique offer where it resulted in me moving down to Miami. I did some work down there in like the Fort Lauderdale, Coconut Grove area. Got to work with a general population down there, a lot of sports athletes as well. And then one of the stipulations was me moving out here to Texas, and I moved to Fort Worth area. I was there for about a year and a half, and I was at APEC when they first kind of got their medical division started up and stuff like that. Shortly after that, got kind of interested in kind of doing my own thing after I kind of went through some trials and tribulations and seeing how growth like occurs within the business side and the management side of running a practice. Ended up having an opportunity to come down here to Austin. I came down here, did like a little scenery drive, seen what was out here because I've never even been here.
Right.
And then after I kind of seen the facility, the spot that I would kind of be looking to start my practice up in, I thought it would be like a no-brainer. Ended up moving down here, been here since the start of the new year. So this past January, started my practice. It's a cash-based clinic that's out in the Lakeway area, just right down the road from Lake Travis. And we hit the ground running. It took about like 2 months for us to really get going. Got everything off the ground, came in, and then boom, the athletes just started running through. I kind of got into the quarterback realm is when I really met with Coach Stanfield. He's been kind of like someone of like a mentor to me in like understanding like the biomechanics of quarterback specific type movement. And it's one guy, you know, you always need to have that friend that, you know, you can bounce ideas off of. That's going to tell you when, you know, your thought processes are wrong, not always be agreeable, you know. I really value those type of people that, you know, they work on your growth and like your understanding of what is going to make what it takes to make like a better knowledge basis of how you like handle your situations when you're doing the specialized work that you and I both do.
Mm.
But yeah, it's worked with quarterbacks from all different levels. I mean, from youth all the way up to NFL to the biggest names. Been around them. It's been pretty cool seeing it. The one thing that I would say is, you know, it's very unique when it comes to these guys. You know, not quarterbacks aren't all the same by any means. Different styles, different types of bodies, different ways to be efficient within the way that they particularly move. So, I mean, I got to be around even like the highest efficient athletes out there, like Patrick Mahomes. We got Sam Ellinger, Quinn Ewers, a bunch of other college guys, professional guys, Jared Stidham. Very, very awesome people to work with. Learn a lot from those guys. They've been around the game for a very long time. You know, developed well. They have a huge knowledge. They know what they're doing. They are who they are. You know, they get it. But picking their brains and understanding, you know, what runs through their brain whenever they're playing a position or their understanding of their movement efficiencies and what works for them best, for sure.
Dope, man. Yeah, super cool journey, doing great stuff in Austin area, but also I know you go to different places. Some of the quarterbacks you mentioned, you'll go to different places and work with them as well. And mentioned Coach Stanfield, who we've had on the show and does a great work with a lot of really good quarterbacks. And you also mentioned just the quarterback position being unique in nature, and you can make arguments what's the most unique position in sports. Well, quarterback position has to be up there, at least talked about, at least argued about, right? Because you have to be an extremely good athlete, but you also have to have this specific set of skills to be able to rotate, deliver as quickly as possible, right? So with that said, going back to what you mentioned about, you know, the quarterback position being so unique, and we've talked about this before off air, and you know what we look for during the assessment process and what we think is important and just kind of different measurements. But could you take us through, you know, a quarterback comes in, what's a typical assessment process going to look like? How are you going to be able to, you know, find some deficiencies or some areas of strengths, and then kind of take us through what that looks like, some measurements you're looking for, and then maybe how you'd go about treating that. You can use an example if you want, or you can just do a broad kind of general breakdown of things.
Yeah, that's awesome. So really, like the assessment, it does. There's two sides of it. Like, you know, y'all obviously can get them in the clinic and you get your chance to see how they are as a mover. But you know, a big component of it is the video analysis of how they throw and what is repetitive for them in nature. So like, I never want to neglect that side of being part of the evaluation. Is them physically playing the sport and seeing how they, you know, go through and solve their problems. How well are they being efficient? So like video analysis, and that's where, like I said, Coach Stanfield comes in huge for me. He makes me understand the game in a totally different way, and I praise him for that. So aside from that piece of being a huge part of the evaluation process, when I have the athletes in here, typically I try to think from a ground up perspective. So, you know, and trying to hit all the main keys that I think that, you know, drives like a good quarterback, right? You have like you have a little bit non-negotiables when it comes to like, you know, utilizing ground forces. Like how well do you do that? Like how well is your spinal rotation? Like in a sense of ability to rotate to produce power. And then, you know, obviously you have to have arm strength. Like that's the big three engine drivers for the most part. But for the most part, like I said, start from the ground up, understanding where the ground force reactions are really coming from. So starting from the ankle, moving up into the hip joints. Ankle start out looking at their stability. A lot of times you find that these kids, they can't really hold their front leg down into the ground. So they lose a lot of that transfer of energy that's coming up the chain. And a lot of that's like a patterning thing. So looking at the foot, turn around, look at the hip complex. I mean, they have to have the ability to rotate on that single leg. So it's rotational capacity with the stability and mobility. I'm not always so worried about them having a ton, but understanding the right balance between their systems. Huge into understanding their spinal movement and their spinal tone. I think that's one thing that's kind of underrated when it comes to it, is understanding the health of these kids' spine. You know, I have a really good example. I won't name the athletes particularly, but you know, one that I have them come down and I do a spinal assessment of where, you know, they just sit with they med ball on their butt and they stand tall and they do like a QL walk. So they just walk their body backwards. And then you can get like a good visual representation of how wavy their spine can get, right? And you know, I've had kids that come in and that they have like, you know, big size, 6'5", 215, have like all the attributes of where they should be able to zip the ball from across the field or even hit a long deep ball, but they just don't have the juice, right? It just, for some reason, they're just super inefficient at it. So like looking at that spine and seeing how well it waves back and forth and how well it's just, you know, is protective and how well they utilize it. And then obviously get into like the shoulder complex. I'm not so worried. I know a lot of the space with anyone who throws a ball, you're always looking at your ER and your IR, like mobility. You know, I like, obviously that's a metric that I'll look at, but I don't worry about it. You know, there's some things I'm like, well, let's increase your ER as much as I can so you can get layback, so you can get velocity output. It's like, I think a lot of that's going to come through the nature of them throwing. But for the most part, I'll look at like their ER and IR strength ratios. You know, just understanding like the stability component of it, because it's that car crash effect after every single throw. I mean, you're getting lengthening of that posterior cuff. So understanding the health status of it, I think is a extremely underrated thing when it comes to them, and like just building out the metrics. Quarterbacks always try to say like, you know, quarterback isn't a position you play, it's who you are. You know, there's a lot that comes through here, and whenever you show them the metrics and the analytics and the ideology behind it, they gravitate to it real quick, because it's just how their brain typically works.
Yeah, super dope. Not to cut you off, but super dope stuff. Two things I want to touch on and dive into a little bit more, because you know you do a lot of great work with the spine, and for those that haven't seen Jimmy's stuff, like we'll link his Instagram, all that stuff you can go see. But there's some really great, unique, kind of forward-thinking approaches to what we call, you know, spinal hygiene, which maybe you can dive into that in a bit more detail. I know you touched a little bit about it, but because that's a huge factor, and everything you just described, it's a huge factor in creating the pathway to throw. If you don't have a pathway to throw, then you're limited, even if you're big and strong, like you mentioned, for that 6'5", 215-pound quarterback, big and strong, but no pathway, you can't use that strength, right? So I think there's a few things that go with that, which you mentioned, and one is creating that pathway. Then you got to be a good mover within that pathway so you can naturally do it. You got to build some strength, some power in the pathway. Then, and it's interesting you brought up external rotation, internal rotation as well in the shoulder, because like you, I think it's an important measurement. I think you have to have an idea of how their shoulder rotates. And like you said, it's not always, you don't always have to crank and go after ER, especially depending where the quarterback is. If the quarterback's mature, if the quarterback is older and he lacks ER and he's not a great thrower, then yeah, maybe that's something that should be addressed. Maybe that's something that you should consider. If the kid's 15 years old, then like you said, the more he throws, the more he's going to have that humeral retroversion where some external rotation is probably gonna happen. And going back to your point about the spine too, the better you can move from your spine, the more that's probably going to assist you to get the external rotation that you need whenever you throw. So long-winded kind of response, but just touch on the spinal hygiene approach just maybe a tad bit more, and then, you know, how you go about determining, okay, his spine moves good, his spine moves poor. I know you talk a lot about the video analysis to kind of compare, but maybe just are there like some measurements or guidelines or numbers that determine, you know, how the spine moves?
Yeah. No, that's definitely a good question. When it comes to like measurements, I don't think that there's so much that we can kind of quantify the way that the spine is typically working. It's more like a visualization type and like a responsiveness, right? So like there's like two ways that you typically try to look at it. You want to see how well the spine is coordinated whenever there's gravity forces being pushed down onto it. And then you want to see how well that the spine will move from a segmental standpoint for whenever they're like on the table, right? Whenever you stand up and you're upright, you know, you get protective spinal tone. You know, all the muscles are up, they're turned on, they're firing. So like the rotation is going to look different compared to whenever you get them down and you get to assess the segmental rotation piece of everything. But for the most part, when I'm going through and I'm doing this, the evaluation piece of it, I mean, I'm seeing how well they rotate from a sitting position, taking everything from the pelvis up, the pelvis down pretty much out of it. And then seeing how well they coordinate within their environment. So try to get them into positions, see in some of the things where, they cross their arms and rotate. I do that one. I don't do it often. It's not like a make or break for me. It's just one of those things where, it just gives me a little bit of information. But that evaluation test that like I've talked about is like how well they coordinate their spine when they do the movements. So doing the QL walks. It's one of those things where it's like, once you look at it enough and you see a ton of different kids at even same position, same body makeup, and you see how different they move, you can pick out, one that's not efficient and one that's super efficient. And you get those all the time. People utilize their body different. And even if they're like their appendicular skeleton's long and they have a long torso spine, you would think that's where they would kind of gravitate towards as like a big engine for them, but sometimes not. And that's their kind of like your missing link. So the evaluation piece, hard to quantify. It is when it comes to the ability to like measure the range of motion, really don't matter a whole lot. It's more of like how it interacts with the forces, if that makes sense.
No, I think that makes perfect sense. I love the way you use it. It's a coordinated sequencing effort of throwing the football, and the spine is part of it. So if someone has more spinal mobility, let's call it in a thoracic rotation test, then let's say quarterback A has, I don't know, let's just say he's got 45 degrees of thoracic rotation where we measure him, right? And then quarterback B has 65 degrees of spinal thoracic rotation whenever we measure him. But quarterback A is a much more fluid rotator. He throws the ball well. It's smooth. So it's like, even though he lacks mobility and maybe we were like, hey, 60 is the standard or whatever, there's no need to chase more if he's using it efficiently, right? Like that's a strength if he's using it. So I think that's a great point, which you brought up. I also want to bring up, unless you have anything more to add about the spine, I do want to go to the shoulders a little bit. I know you could probably talk about the spine forever.
Just one more thing that I think is like extremely important when it comes to it. Like whenever like we're discussing spine, we're thinking lumbar to thoracic, but understanding the cervical spine for a quarterback. I mean, they literally stand in this position and looking here like all the time, right? Just because of the nature of how they're positioned whenever they're set up. So like understanding the cervical spine, there's a lot of reflexes that are integrated from the spine to the ocular system. So like your cervical ocular reflexes and your vestibular ocular reflexes. So like making sure like the rotation piece is there in the neck is one of the extremely underrated things. Prime example, say if a right-handed quarterback is going to go throw, but they have a hard time looking to their left, right? And what would be the inherent option to look farther to the left if you're trying to scan across the field? Is actually turn your shoulders and close yourself off. So it's like, it's definitely don't go neglected because it has a lot to do with how else you rotate from down the chain, not just where you're at in your T-spine and your lumbar.
That's a great point with the cervical spine. And that's probably, maybe that's why my jaw's all messed up because of 10, 15 years of constantly doing that and shifting. But no, I think that's fantastic. And we'll talk more about the spine, some soft tissue stuff here in a second, but I do want to touch on the shoulder because you brought up another, we talked about, don't have to go chasing ER, right? And I think for me and how we go about things is, baseball players are going to be different than quarterbacks, right? Like there's a performance, but also like a health standard of why ER can be important. Whole different conversation. But for quarterbacks, if a kid comes in, he's got 130 degrees of passive ER, there's no need to chase more. You've got plenty. And now it's like building strength within that range of motion, which a lot of quarterbacks, haven't been exposed to maybe like proper shoulder function and movement and where the humerus should be in the socket, right? And so I think it's developing, but at the same time, I don't get too concerned with the ER for a quarterback unless like he doesn't have any, he doesn't spin it very good. There's no velo on the ball, and he's got like 100 degrees. You know what I mean? Like I don't think like if he's got 130, we're good. If he's got 120, we're good. If he can barely get past his arm, then there's probably some energy that could be involved in improving the shoulder rotation, the shoulder movement that could probably translate to throwing the ball. So I know you talked about not having a set number with the spine. Do you have a set number with external rotation? Again, just with quarterbacks, not with baseball players. Is there a set number, or is it more like a feel thing? Okay, he's got enough, or man, he's stiff as can be. We need to do some soft tissue stuff and kind of open that up.
Yeah. So there's two sides of that. question for sure. I mean, from set numbers, I mean, you're looking anywhere between staying strong from 100 degrees of ER to 125. I mean, like those are like to me, that's all acceptable, right? I'm like, if you have these, that's great. If you don't, and it makes, like you said, inefficient whenever you're throwing, problematic. But also, like I've seen guys, they're extremely somewhat stiff up there, and they don't really get that ER that you would expect. And you're like, whoa, like you're a guy who like zips it, you
Mm-hmm.
know. But that's where the consideration of that type of athlete kind of comes in play. It's like, is he inherently like a stiff guy? And whenever you watch him throw, does the passive layback kind of happen because of the amount of momentum and torque that he's getting? Like it forces it back, but when I have him on table, I can't get it there to that same degree. So it's like understanding the two sides of it.
Mm-hmm.
I mean, I can measure it, it's great, but when he's actively throwing, he sets it and lays it back to 130, 140 just because of passive movement. And to me, the way that my brain kind of processes it, I'm like, oh, that's his rubber band effect. That's what makes him whippy. And you see this, like, there's quarterbacks out there that all arm, but they freaking whip it, they can zip it. And then there's other guys that they need to utilize the rest of their body extremely well to make that type of like almost like an effort throw. Some are effortless and some are a lot high end effort. But yeah, it really depends. But to answer your question, around that 100 to 125, like I mean, you're fine. Just
so we're in that ballpark. Yeah.
Yeah.
Yeah, no, that's fat, man. There's so much stuff I could dive into that subject, but we'll keep it surface level ish right now for everyone because I think we're at a good point right now as opposed to diving too much in the weeds. So maybe off air we can dive a little bit more. But Jimmy, I do want to dive into a bit more stuff, and especially with your call it your specific ability and what you do. Soft tissue work, like hands-on work, is something big that you do. And the assessment we're talking about and the soft tissue work isn't just for quarterbacks that are injured or dealing with something. I think it's important and crucial for anyone that wants to maximize performance and maximize potential risk to reduce risk of injury should have some type of evaluation done so you know how you move, right? But with that said, can you talk about some of the soft tissue parameters that you do with quarterback, maybe some areas that are specifically tight more than usual, or where you find yourself like actually digging into them or needling or whatever it is, whatever soft tissue modality that you're doing? Kind of talk about some of the areas that you kind of see get tight and that you have to spend some time on with quarterbacks.
Yeah. I mean, just by nature, it's super repetitive motion, right? So you're going to have your sort of natural patterning resulting in some inherent stiffness for some of the muscles that at times could be advantageous, right? But for the most part, I mean, when it comes down to soft tissue, you're still trying to work on the healthiness and status of the tissue. Always try to tell people it's more than just the hands-on. Like your hydration is probably like the key when it comes to it. It's hard to rip a nice juicy steak, and it's pretty easy to rip a dry piece of beef jerky. When it comes down to it. So staying on top of it, but working all the posterior cuff muscles, some of the subscap type releases. I do that more out of comfortability for that player. And then some of the guys that come in, they know what they want and they know what they need. And that's where I think I really try to take the back seat as like a performance therapist. Is like I gotta listen to the athletes.
Yep.
I can be like I guess critical about people's like body and the way it moves. But I'm telling you right now, most people know their bodies better than I ever will know their body, no matter how many times I put my hands on them. So
Right.
I try to take that feedback from them and to understand it and then assess it and then make that judgment call of what I'm gonna do. Right-handed quarterbacks, you're always looking at the left hip at some involvement, looking at that anterior oblique sling from the left hip to the right shoulder. Always trying to work something there. I would say pec minor for the most part is what I get reported to me about feeling like stiff. Like I just feel stiff across my chest a little bit.
Yep.
And I'm like, well, I mean, that makes sense. You're throwing the ball all the time. So let's work on, keeping some healthy lengthening and pliability to the muscle tissue itself. So, I mean, very general stuff when it comes to it. There's a great, have you ever read the TB12 method book?
I have not. I know what you're talking about. I have not yet.
Yeah, super awesome read. It's one of the books that kind of like got me an idea of muscle pliability, and tissue and like understanding and like kind of prioritizing it in the sense of, I can push on the tissue all I want. But if you're in constant state of dehydration or whatever it may be, there's only so much I could do to help promote some blood flow to those areas.
Yeah,
So it's extremely
That's a great point. And talking about like it's a full effort kind of priority to have quality soft tissue. Right? Like you said, if someone's not living right or not drinking like he's supposed to drink, and you come in and you're giving him some like some pec minor release or something, it may feel good, pretty good, but or for a little bit, but it's going to be like a temporary fix. It's going to temporarily feel good. If you want like chronic changes, it takes repetitions of seeing someone like you getting that work done, but also staying hydrated, making sure that you having some nutritional food that have nutritional value in your food, right? There's a lot of stuff that goes on. We've both seen athletes. I've had some athletes that, they've had some hammy tweaks or different pulls here and there. And then like, once we clean up their diet, then like those things just kind of get eliminated. You know what I mean? Now, there's a bunch of other factors that go into play. I'm not saying go eat healthy food and you're not going to pull anything. Fast athletes move really fast, but I think back to your point and just the soft tissue and using the pec minor. That's one thing that I think the pec minor, because a lot of football players, baseball players have been exposed to a lot. Quarterbacks are now kind of getting into this more specific training, if you will, I think is fair to say. And so, but it's still kind of new to them to be like, oh wow, it actually feels kind of good. I feel like opened up, right? But even for like guys like me or you, if we're working all day and we're in this position or just like this, our pec minor is naturally getting tight. So it's just like a normal thing, or like, it makes sense that a pec minor is going to be a naturally kind of area to focus on. Have you seen, or are you able to not document necessarily, but what are some common injuries that you've seen or treated in quarterbacks? Like, we're starting to see a little bit more baseball injuries, for lack of better terms, come over to the quarterback position, some lat strains, oblique strains, stuff that, when we see it in the base, like if someone comes in for treatment, he's a baseball player, it makes sense, right? If someone comes for training in off season and they have this issue, it makes sense. We've seen it all the time with baseball players, but football, it's a little bit different, right? Are you starting to see some injuries from baseball? And can you talk about maybe just some common injuries that you're seeing that maybe you could see happen more that are happening in the quarterback position?
Yeah. So really, when it comes, if you take out like all the whole idea of traumatic base injury, so like any type of hip base injuries, like AC joint, fractures, all that type of stuff, eliminate those.
Non-contact injuries. Yep.
Yeah, non-contact injuries. Majority of the time, you're kind of running into the overuse type of side of things. So developing your basic like tendonitis, any type of rotator cuff tendonitis, just from the repetitive use, bicep tendonitis. But the oblique strains, I think, is one thing that's kind of hitting a little heavier now. And I think it's because of this methodology that the quarterbacks are kind of transitioning to. And you see it with Josh Allen, right? He was a very linear thrower, 3 years ago, and then he switched it up and became this rotational beast. And that takes a lot of effort to work from your inside hip all the way to your shoulder, and it's pure power rotating and driving it through. So I've seen a lot more like rotational oblique type strains. Another one is like very like facilitated upper traps. And I think a lot of this has to be protective in nature. Usually it starts to kind of develop when they're in like hitting training camps and when the volume of throwing is kind of up. The instability starts to amount just due to the volume. They're not getting as much recovery that they need in the sense of like stabilizing the shoulder after going out throwing 100 or so balls during practice or what have you. But working on the upper trap and even bleeding into the neck. It's not necessarily injury. I would say it's more of like a facilitation or like a protective compensation that they have. But in turn, really, mostly those.
Yeah, no, I think you nailed it and hit some good things. Like the overuse it's always been around in baseball, right? Like year-round baseball. Now you got like year-round quarterbacks, right? From fall season to 7-on-7 to quarterback trainers, which is great, and it's needed to do that. But with that now, like other parameters have to come into place to prevent the soft tissue injuries coming up. Not even injuries, right? I think like kind of what you got to is it's not so much the big injuries that are happening, the lat strains, oblique strains. Yeah, that's happening, but it's more of like the kind of like nicks and pains that you can play through, discomforts, bicep tendonitis, anterior joint pain, the shoulder, whatever it may be. It's more of like those kind of nagging injuries I feel like that are kind of popping out that as football players, you kind of just taught, hey, just kind of play through it, right? But as a quarterback, it's a little bit different. You need to be able to have trust in that. So, we've had quarterbacks that have come in, I'm sure you're similar, where you give them like a few basic movements for the shoulder, like we'll call it just like shoulder health, shoulder hygiene, right? Like we call the spinal hygiene. If you give them some like basic movements to clean up how their shoulder just naturally moves, a basic external rotation, a serratus slide, a low trap movement, a lot of times that kind of cleans up just because they've never been exposed to any of that, right? Like it's just kind of different in football from baseball, which is like we talked about, it's transitioning over. Have you kind of seen that as well? Like you don't have to be as advanced with taking care of a shoulder of a quarterback that you do with the pitcher.
Yeah, absolutely. And like honestly, this comes off whenever I'm taking like a baseball player and a football player and I compare it. Whenever I do like the ER and IR like strength ratios, baseball players, I would say 8 out of 10, maybe even fewer than that, have like adequate ratios. But for the most part, like quarterbacks, they typically have pretty good ratios. They stay around that 0.9 ratio to the ER to the IR. But yeah, for the most part, it's like I don't really see a ton of like shoulder base injuries with throwing that ball unless that's how they predominantly throw it.
Yeah.
I have one kid right now. I mean, you look at him throw on video analysis and stuff like that, and I mean, he's hitting his layback; it's parallel to the ground, and but at the same time, like this kid also is nothing but a whip to him, and like it's one of those things where I'm like, hey, we look at your numbers, it's like your stability is really really off, just from a strength standpoint. And I mean, so it's the way that we got to quantify it, right? I can't.
Yep.
I mean, I can do all the slide testing that I want, kind of look at it, but yeah, it's definitely a unique thing when it comes from transitioning from a baseball player to a baseball player's shoulder to a football player's shoulder. Typically, the football player's shoulder is stronger in the sense of, when I say stronger, I mean in the sense of being healthier for the most part.
Yep.
But yeah, I mean, for the most part.
Yeah, I think you're right. Yeah, it's healthier. It's even though the throwing is more, it's like it may be like 1,200 degrees per second of internal rotation you have as a quarterback, right? Like that'd be fairly high. Or baseball, it could be 7,000 plus, right? So it's like even with baseball, even if a baseball player throws, let's say like 50 pitches, he's probably gonna be way more blown up than a quarterback that threw 100 balls in practice one day. Just because of the speed of it. But still, like you mentioned, a lot of value there, something to know. And usually it's just the overuse issue or having like no awareness of like what the humerus is doing at all, which is common, especially with your younger Q. So, Jimmy, I want to go through something like kind of like just your process in general, right? Because obviously, you're not just a PT, right? That's your main thing. You're able to get your hands on, but you're really like there's not even like words to describe kind of what this niche is turning to, essentially, right? It's just like a performance manager, performance coach. Anything you can do to assist performance is kind of what you do. That's not a title, but from that side looking in, it's kind of what you do, right? So you have the quarterbacks come in, you go through the assessment. If there's injuries or something you need to work on, you do that. But what's like a typical process going to look like to like train the quarterback? Like what is your, not method, but what is your role would be the best way when it comes to quarterback X or quarterback B is coming in and you assess him. And now, like, what's the plan moving forward? Do you just keep them in house? Do you write the program, do some in house, give some to a strength coach or their coach at school, or kind of just go through that process? I know I use like a high school example, but it can be NFL, college, whatever you want to use.
Yeah. So majority of the time, whenever like they come in and we kind of figure out these faulty, say, let's just use athletic movement patterns for an example. It's one of those things where I try to find out where the inefficiency are, and then where they're super efficient at. And then a lot of times it's kind of like, exacerbating, or I won't say exacerbating, enhancing their qualities that make them good. Like there's a lot of times where it depends on the time of season. I think that's one of the things that's kind of overrated. Like say if I get a quarterback that's fresh that comes in here for off season, a lot of things that they did during the season that, we just have to go back and try to restore. That's when we actually put more of a focus on them developing as just a pure mover, trying to help them either move better, have a higher quality state of movement and capacities. But then heading like towards the season type deal, that's when we start getting more specific and trying to fine tune what makes them good at what they do. And you see this like from a body standpoint. You have like, a lot of muscular compliant type people, and then you have like a stiff elastic type of people. People who absorb forces very well, and the people who do propulsion very well. So it's like understanding like who that is and why they do that, and then trying to attack it, and get them prepared for what they're about to go into. Example, like say someone who's extremely whippy,
Yep.
when it's heading towards that season and we're getting close to that point of like, hey man, like we need to really work on like your explosive, in a sense of reactive strength. So being stiff, boom, getting out of your position fast. And then I'll fall into more players who are like muscular compliant, that they dominate the weight room. They produce force very, very well, and it's not extremely fast, but it's a high output. That's when I'm like, hey, let's work on these things and try to really like power through your rotation. Work on that type of strength. So it's a very it's a difficult question to answer, but it's like, man, it really is so dependent on how those individual people like come in and present. Because
I think that's dope. No, I think that's dope.
yeah.
Yeah,
I would give like I do A, B, C, D, and that's the method. You know what I mean?
Yeah.
And I'd say on a single day, if I have 8 different quarterbacks come in, and even if it's like the same issue for all 8, the treatment and then what we do looks different for all 8
right.
because it's a body style and a body type, and then the way that they interact with their environment. It's
no, I think it's a dope answer. I think it's for every athlete. There's going to be differences, but then especially the quarterback position, because quarterback A doesn't feel like quarterback C, so you have to do what's going to help quarterback A. And even if quarterback C is similar, there's still some like differences in how he delivers the ball. So there's going to be differences in how you treat or what you kind of implement for his plan with that. So it's a program that you would that you would not only do, but it's something that you would do. Probably. It can be done season out of season. It just will depend on kind of their needs at the time, right? And like the volume needs at the time, and something that you pair with obviously your other weight room stuff, your other strength stuff. It's just another part of the equation, right? Like another tool in the tool belt, essentially, as everyone has to say.
Yep.
Maybe a big hammer, a big important tool. But with that said, Jimmy, man, you've been so gracious with your time, and you've like answered all these questions in a really, really complex doctor way.
Sorry.
But but at the same time, doing it where everyone can understand. Like you did a really good job, like not dumbing it down, but answering it and processing it where people can kind of follow, if that makes sense. You did a really, really good job. Super interesting for me to talk about and learn. And I think our viewers, anyone watching this, is just like quarterback junkies to begin with. So I think they're going to get a kick out of this. But before we let you go, we always like having our guests give advice to younger quarterbacks, right? So, for example, our college quarterbacks, our pro quarterbacks that have come on, former quarterbacks, they'll give quarterback type advice. Our coaches will give quarterback type advice, right? So I want you to give some type of advice to a younger quarterback as it relates to like the field that you're involved with, the training you're involved with, whether it's, hey, get some type of assessment or this and that. Just what would be your 1 to 2 kind of keys of advice you would give to, let's call it a quarterback who is a varsity quarterback, let's say borderline Division I, has some stuff that he has to work on to get to the next level. So he's got something to his game. He's not starting from scratch, but he's not some big blue chipper either. What would be some basic advice you'd give to that kid as it relates to his training?
Yeah. I mean, in all honesty, when it comes down to it, I think that it's extremely important for these athletes, especially the quarterbacks. They're super critical and analytical. It's like, don't compare yourself. Like control the controllables. You can control your effort, and then your consistency. Put most of your focus into those type of avenues, and I'm sure that your results going to follow. And then, like when it comes from a training standpoint, there's your development as an athlete is always foundational. Like you do need to have you have to have good strength, you have to have good power output, you have to have these type things to be elite. But at the same time, like your movement literacy and capacity and efficiency is probably what's going to win you most of the jobs that you're trying to get. I mean, you take quarterback A and B, you have them both throw the same ball. One looks kind of effortlessly, and the other one looks like he's really trying to get it there, and it's like a little tough for him. I bet a coach is going to look at both quarterbacks and want to take the efficient one. And that's just how it typically works. They want the guy who just looks like he can just flick it.
Mm.
And I think that's extremely important. So, it's more than just your output numbers. Don't worry about chasing strength and your power output all the time. They're foundational. You must have them. But it's not end all be all. Be a really good mover. Take care of your body. Develop capacities, tolerance to odd positions, because you get hit from the blind side. Your body's torqued up quite a bit, and you got to be ready to take that force and not get hurt and get up and make another play.
Yeah, that's a good word, and kind of like we talked about, it's a there's a lot of factors to be a good quarterback, and this is there's a lot of different things that go on and being a good quarterback, and this is a big part of it. So again, thank you, Jimmy, for coming on. Like, that was awesome, eye opening. Again, did a great job, like taking a complex conversation and making it where people can understand and follow. It was really well done. Before we get you out of here, let everyone know where they can find you, about the business. They can find your business, all that stuff, the social media stuff, stuff I'm not very good at. Let everyone know where they can find you, Twitter, Instagram, all that stuff.
Yeah, Twitter and Instagram, I'm pretty sure it's just Jimmy Rowland and maybe Jimmy Rowland 4, I think. Just depends on what the handle is. But you can just search it up. I'm sure I would probably be one of the top ones that pop up on there. And then, like, the company I have out here in Lakeway, it's Helix Physical Therapy and Chiropractic. We specialize in, athlete care and performance care. So rather, if you're just, your mom and pop or, average gym pop athlete to, your Patrick Mahomes, like, we're be more than happy to help you guys out and, try to make you guys live a healthy life and a fulfilled life for sure.
Awesome. Yeah, y'all go check them out. And they do a fantastic job. We send athletes over there. They've taken care of my jaw, my wife, family members. So they do a great job. But Jimmy, thanks so much for coming on again. Sincerely, that was great. We'll do it again. We can talk more off air about some fun stuff. But everyone, if you like this type of content, please like, subscribe, all that YouTube podcast jargon. It does help us. So make sure y'all give a like and subscribe. And we'll see y'all next time. Peace.